The concept of body habitus describes the overall physical build of a patient, and how that build influences internal organ position. It is not simply a description of body size. It reflects how the thoracic and abdominal organs are arranged within the cavity of the body. Body habitus affects the level of the diaphragm, the orientation of the heart, the apparent length of the lungs, and the position of abdominal structures. As a result, two healthy patients can produce radiographs that appear quite different, even when no pathology is present. Understanding body habitus helps prevent misinterpretation by reminding us that normal anatomical appearance is not identical in every patient. In clinical imaging, recognizing body habitus is part of recognizing normal variation. To make this easier to understand, let's talk about the body habitus of an adult healthy person. The hypersthenic body habitus is characterized by a broad and thick body build. The thorax appears wide, and the abdominal cavity is relatively short from top to bottom. The diaphragm in hypersthenic individuals tends to sit higher within the thoracic cavity. Because the abdominal contents are pushed upward, the lungs appear shorter in vertical length. The heart often assumes a more transverse or horizontal orientation. On a frontal chest radiograph, this can create the impression of a widened cardiac silhouette. It is important to understand that this appearance may be completely normal for that patient. A horizontal heart in a hypersthenic patient should not immediately suggest pathology. The stomach is also positioned higher and more horizontally within the abdomen. This affects the expected location of the gastric bubble on imaging. From a technical perspective, hypersthenic patients often require adjustments in exposure due to increased tissue thickness. The radiographer must consider adequate penetration while maintaining proper contrast. Collimation should also be carefully adjusted, as organs appear more crowded within a shorter vertical space. The sthenic body habitus represents what is generally considered the average body build. The thorax and abdomen are proportionate, with balanced width and height. In radiology, many textbook examples are based on this body type. It serves as the reference pattern for typical organ positioning. The diaphragm sits at a moderate level within the thoracic cavity. The lungs demonstrate an average vertical length. The heart assumes an oblique orientation, neither excessively horizontal nor excessively vertical. Abdominal organs are positioned in a manner that aligns closely with standard anatomical diagrams. Because sthenic patients approximate the standard anatomical model, imaging interpretation is often more straightforward. However, it is important not to assume that this pattern applies to every patient. In practice, many patients fall somewhere between sthenic and adjacent habitus types. From a radiographic standpoint, exposure factors are usually more predictable in this body type. Organ spacing tends to be balanced, allowing for consistent centering and collimation. The hyposthenic body habitus is characterized by a slender build with a slightly elongated thorax. The body appears lean, and the abdominal cavity is longer vertically than in average builds. In radiology, this body type begins to demonstrate noticeable downward displacement of abdominal structures. The diaphragm tends to sit lower within the thoracic cavity. As a result, the lungs appear longer vertically compared to average builds. The heart becomes more vertically oriented. On a chest radiograph, this can create a narrower cardiac silhouette. It is important not to misinterpret this vertical orientation as abnormal. The stomach also shifts slightly downward and assumes a more vertical configuration. These shifts occur because the elongated abdominal cavity allows organs to settle lower under gravity. From a technical perspective, hyposthenic patients may require careful collimation to ensure that the full vertical lung fields are included. The radiographer must anticipate increased vertical anatomical length during positioning. Compared to hypersthenic individuals, structures appear less crowded and more vertically distributed. Recognizing the hyposthenic pattern helps prevent undercentering and incomplete coverage of anatomical regions. The asthenic body habitus represents the extreme of slender body build. The thorax is narrow, and the body appears tall and thin. In radiology, this body type demonstrates the most pronounced downward displacement of abdominal organs. The diaphragm sits noticeably lower within the thoracic cavity. The lungs appear long and vertically extended. The heart assumes a markedly vertical orientation. On imaging, this may create the appearance of a narrow and elongated cardiac silhouette. The stomach is positioned lower in the abdomen and often appears more elongated. Because of the narrow thoracic cavity, the mediastinum may appear relatively slender. In imaging practice, radiographers must ensure that the entire vertical extent of the lungs is captured. Improper centering may result in exclusion of the lung apices or costophrenic angles due to increased vertical length. Exposure factors may also require adjustment because of reduced tissue thickness compared to broader body builds. The Asthenic habitus demonstrates how significantly body build can alter organ orientation without indicating pathology.